Hi, my name is Madison Crothers, and I'm a senior health science major at Clemson University. This semester, I had the opportunity to intern with the Hawkins Foundation. The Hawkins Foundation is located in Building C of Patewood Memorial Hospital in Greenville, South Carolina. The Hawkins Foundation is a not-for-profit organization that works towards improvements in orthopedic medicine and outcomes of patients. The Hawkins Foundation works with physicians from the Greenville Health System in the Steadman Hawkins Clinic of the Carolinas, physical therapists, athletic trainers, and sports medicine fellows. The mission of the Hawkins Foundation is to advance orthopedics through research and education. The Hawkins Foundation focuses on 3 different types of research: clinical research, effectiveness research, and biomedical research. As the research intern for the Hawkins Foundation, I was able to witness all of these aspects of research. At the Hawkins Foundation, the goal of the research internship is to gain valuable real-world experience in an orthopedic clinical environment and to work hand-in-hand with physicians, physical therapists, and athletic trainers through the development and collection of research data. At the Hawkins Foundation, I had many different roles and responsibilities and opportunities to interact with these people. One opportunity I had was following Dr. Cassis, a sports medicine physician, and Dr. Bernicle, a joint replacement orthopedic surgeon. During my time shadowing both of these doctors, I learned a lot about patient-provider communication, how to diagnose osteoarthritis, and a lot about the different types of treatments for arthritis in the knee, hip, and shoulder. One of my roles as the research intern was reading over protocols and learning about different active research projects. There are 2 main research projects that I worked on. One of these was the BioD research project. BioD is a study that wants to test the effectiveness of stem cell injection treatment versus steroid injection in the knees with stage 3 or 4 osteoarthritis. For this study, I helped screen patients, enroll patients using the questionnaire, and grade the questionnaire and input the findings into Excel. To screen for potential patients, I would go on the main computer as well as the laptop and go through 3 physician schedules for that week and read the patient charts to see if they were good candidates for BioD, as well as meet all of the inclusion and exclusion criteria. This exclusion criteria for BioD includes having fibromyalgia, diabetes, being over 80 years old, having a BMI over 40, or having had a knee arthroplasty on that knee. The other research project I worked on was TXA. The TXA research question is based on if patients getting a total hip replacement bleed less from topical TXA compared to not receiving it. TXA is the current standard of care, but is given intravenously, which can cause major complications. I was able to help enroll patients with Dr. Bernicle, give questionnaires, and actually see all of these patients needed for the study be enrolled. I also graded these questionnaires and inputted the data into different Excel files. One of my other roles was inputting SOS forms. SOS forms are forms indicating an upcoming surgery that are inputted into the surgical outcome system. This system sends emails to patients to have them fill out surveys before and after the surgery at set times. I input these SOS forms for the surgical doctors here and logged the patients onto their specified file on Excel for shoulders, knees, and other surgeries. During the logging, I learned a lot about different surgeries that can be done on each of these joints. When logging the surgeries, I had to read what type of surgery they were going to be doing and categorize it accordingly. This taught me a lot about the difference in total shoulder, reverse total shoulder, rotator cuff repairs, and much more. During my time as the research intern, I was also able to witness a few research labs and help out in one. The lab is set up as a mock operating room on the 4th floor of the Building C at Patewood Memorial Hospital. This lab is used for doctors, different surgical clients, the Clemson Bioengineering program, and some other college cadaver labs. This is used in conjunction with the conference room where academic sessions and different representatives from companies come and talk. One of the labs I was able to watch was a total hip replacement spacer that Dr. Bernicle is working on. He explained that hip spacers are used for patients who get infections in the hip joint after total hip replacement. The spacer is used as a temporary hip that is coated with antibiotics. This was super interesting to learn about and learn more about infection rates of different surgeries. I was also able to help set up a knee arthroplasty and hip arthroplasty lab. I helped Matt, who is in charge of the labs and lab schedule, with setting up the specimens, cleaning them, and cleaning up after the lab was over. A main part of my internship was being flexible and willing to help out in any way that Taylor, the research assistant, and Kyle, the research coordinator, needed me to. By being flexible and being able to catch on quickly to things that were explained to me, I learned a lot about what they did as the research staff at the Hawkins Foundation. Towards the end of my internship, I wrote a literature review on scapular winging. I had seen scapular winging being treated once while I was shadowing with Dr. Tolan and Dr. Rowland in the clinic. I chose this topic because it seemed very interesting and relatively rare. Through my research paper, I learned so much about the shoulder and different mechanisms behind the movement of the scapula. I learned about the nerves and which nerve innervates which muscle and causes either medial or lateral scapular winging. During my time shadowing, I was also able to work with the current fellowship class for sports medicine, total joint, and primary care. I learned so much from watching and speaking with these fellows. I was able to watch Dr. Campbell set up and rip apart a knee joint in preparation for a knee arthroscopy happening the next morning. He showed me and walked through a lot of the anatomy of the knee, which was very helpful to be able to implement this knowledge during my clinic time. I shadowed Dr. Rowland in Dr. Tolan's clinic and learned a lot about his career path after college and medical school, as well as a lot about patient-centered care and patient-provider communication. He also made it a point to walk through his exact steps in giving an intra-articular injection in the shoulder. I was also able to work with Dr. Millador, who works with Dr. Bernicle. I was able to watch him in lab a couple of times, doing total hip and total knees. Lastly, I was able to work with Dr. Crowder in Dr. Cassis's clinic. While shadowing with her, she walked me through how to do a knee exam and what to look for in a patient with osteoarthritis. My goal for the internship was to be able to conduct and assess a research questionnaire, screen for patients thoroughly, list the different research projects with their inclusion and exclusion criteria, and learn more about the medical field. I am happy to say that this internship met and exceeded all of my goals I had set for myself. From my internship, I learned about myself, what it meant to be flexible, and about professionalism in the workplace. I believe that the Hawkins Foundation research internship has prepared me for my future as a healthcare provider, and I am very grateful to have been selected to be a part of it.